Well, when thinking about the risk of radiation exposure to the patient, I like to think in terms of the dose of radiation a patient receives. And it's important to remember that that dose is cumulative over time. At certain doses, we know that radiation will cause cataracts, skin burns, may cause harmful effects to a developing fetus. At other doses, it can be associated with an increased risk of cancer. And then at even higher doses, we know that radiation can be associated with radiation sickness and even death. The medical term that we use to define the amount of radiation dose, the exposure of radiation that a patient receives is a sievert. A sievert is defined as the biological effective dose on human tissue. So for example, a patient gets on an airplane, someone gets on an airplane, they get radiation, and that radiation dose traveling from coast to coast on an airplane is about 0.03 millisieverts. So just to put it in perspective, myself as an interventional radiologist, I receive about 3 millisieverts or so of radiation from just background exposure. We've learned a lot about radiation exposure from the atomic bomb explosions in World War II. Someone standing about 2 miles away from the Hiroshima atomic bomb explosion probably received about 5 millisieverts of radiation. We know that cancer from radiation exposure is associated with dosages of around 100 millisieverts, and death can be seen in the thousands, to around 10,000 millisieverts or so. Metal detectors, or those new body scans that you see in airports, absolutely not associated with increased risk of really anything from radiation. Those produce what's called backscatter radiation. It's a very low energy X-ray that comes out. It kind of shoots at the whole body, and it doesn't even really penetrate the skin. They call it backscatter radiation. So it just bounces off. It'll detect metal is what it does. So it doesn't even penetrate human tissue. The radiation from flying coast to coast is very small. It's less than a chest X-ray. Again, we measure that in terms of sieverts. Sieverts is the biological effective dose on human tissue. And that dose for traveling coast to coast is about 0.03 millisieverts. The dose from a chest X-ray is about 0.1 millisieverts. So, and then you got to get up into the 100 range, 100 to really start talking about a fairly significant risk of cancer. Now, when you're talking about a PET CT scan, you're talking about dosages of around 20 millisieverts. So, and it can be cumulative. So several PET CT scans over several years, then, yes, there's going to be some increased risk. How can a patient be careful about not being overexposed? Well, the first thing a patient needs to remember is that imaging nowadays is just a fundamental part of the care of patients. It has revolutionized the delivery of care. We're able to diagnose and do things that we weren't able to do because of imaging. No questions, it's made tremendous advances. But I think it's important for the patient to remember that the studies are appropriately done and to take some ownership to the process and hold the provider accountable for ordering that study. Just question, why are we doing this? And most of the time it's appropriately utilized. It should be done. It's going to answer an important question. But nevertheless, the patient should take some ownership to the process and just ask, why are we doing this? Maybe is there another way we could do this with less radiation, like maybe ultrasound, which has no radiation, or MRI, which has no radiation, or plain film with much lower radiation doses, like as I said, 0.1 millisieverts for chest X-ray. So is there another way to do it? I think that the patient also needs to be aware that nowadays we're doing things to really look out for their best interest. When we perform X-ray studies, like we place lead shields on areas that aren't being scanned. There's software that we utilize that can change the dosage depending on the thickness of the body part that we're trying to image, so we can lower that dose. And I think over time, with new technology, you're going to see the dosage go down even more and more. I will say that organized radiology through societies like the American College of Radiology, ACR, have done some things to kind of promote awareness to the patient regarding radiation safety. I would encourage patients to go to a site called imagegently.org, imagegently.org. There's a lot of good, useful information on that site and about some of the things we're talking about here.